Hi, Dr. Garima here, recording again after almost a month's break. Many things happened because of which I could not record. So all the exam given candidates, I would say, those who have just appeared in the month of March, it's been almost 2 weeks since you all have given the exam. How are you guys feeling about it? I've been receiving messages from a lot of candidates saying that they are nervous, they don't know what's going to happen, will they clear or not, and the anxiety that is with it because it is an expensive exam and you have devoted considerable time and energy. And of course, nobody wants to fail in the exam. Uh, See, my suggestion or opinion or comment to you would be ADC exam, take it as a journey. Don't take it personally if you don't clear in the first attempt. Because first thing is that there is no set percentage criteria. It's not like it's a 100 mark paper and the passing line is say 50 or 60. If you score above it, all of those who have scored about it pass. It's a percentile system, meaning if majority of the candidates have scored like 30 and you score somewhere around 28 or 32, you kind of clear. But if you score say 20, you may not pass. So similarly, if a lot of candidates score like out of 180, and even if you have scored 60, you may not pass. So, who decides the percentile? ADC does. Is there any transparency? No. Why? It's a money making exam. So, they want more candidates to keep on appearing because they make business out of it. Their latest newspaper itself says that their number of employees have increased and they take all the funding from the candidates, I think, who have given the exam. You read in on their own website, they have given their finances, and in the last year itself, it's up by $1 million. So why would they lose on the business? To be very honest. But it doesn't matter because this is a mandatory exam that you have to give if you have to study in Australia. So be prepared to shell out a lot of money. But the good thing is that eventually you will clear. So your goal should be to clear the exam, no matter the attempts. If you want to focus on the fruit of your effort, then it's going to be very painful. You should just focus on your effort and keep giving it without getting disturbed in your mind. And at some attempt, you will clear. So have the finances ready with you. It's as simple as that. You may have given your best attempt, but because there is no transparency, you really don't know why you failed or sometimes even why you passed. Okay. There are candidates who said their one paper was bad, but the other three were fine, and yet they clear in that one paper and not in the one which they thought they would. So don't think so much. If you have given your best, have faith. Really have faith. In the due course of the timeline which is appropriate for you, you would clear. And part one is just a very small baby step. The major chunk of effort goes in the part two. But of course, part one is also quite exhausting because you have to solve so many questions, and that's why you need to have a clear idea of how to solve those questions. If given more time in the exam, probably you would have marked more right answers. And that's why practicing mocks becomes very important because the more you practice, the faster you can solve it because there is a timeline, which is a deadline. And you have to up your skills in reading the question like really fast, identifying the keywords, and jumping onto the answer because you don't have time to rethink. If you take a lot of time, then you wouldn't be solving all the questions, and hence, again, a loss in the exam. So, anyways, let's solve one mock today. I mean, one question. Uh, it's basically how you solve it determines how you get the correct answer in the most fastest way. So, of course, your concept should be very clear. If you don't know that particular subject, you cannot clear. And even if you know the particular subject, then you have to train your eyes to identify the keywords and train your brain to see the keywords, because they are big, big scenarios which are asked in the exam. And then there's too much of information, and you have to filter out what are the keywords, because it's a trap. But the scenarios are really nice, because that's how exactly sometimes you'll get a patient in the clinical scenario. They'll be giving you a lot of information, and then you have to ask very specific question to narrow down the diagnosis. Because unless you get the proper diagnosis, you won't be performing a right kind of treatment, you know. So, especially in cases of pulpal diagnosis, you don't want the patient to come back in pain, so you have to diagnose and treat the condition very, very appropriately. So let's start. A 33-year-old Aboriginal male. Immediately when I read this four words, Aboriginal male, you know, Aboriginal, that's a keyword. Okay. Aboriginal is a keyword. Why? Because they are the native Australians, and you have to have a certain cultural respect for them. Also, you have to understand that because they are native Australians, they may not be able to speak the English language. So you have to, whatever you speak, have to speak slowly and try and understand, and also make sure whatever you are saying, they can understand properly. And sometimes they have some, you know, diseases that may require prophylaxis. So you have to be very vigilant when you are checking an Aboriginal. Anyways, a 33-year-old. Why the age matters here? It's a pretty young patient. 33 is pretty young, you know. Okay, so immediately when I read a 33-year-old Aboriginal, what are the keywords that pop in my mind? It's a young patient and it's a native Australian. Okay. And then again in the bracket, they have mentioned he cannot talk English. Okay. So that means immediately there is a communication gap. Presented at your clinic with his 14-year-old son who can speak English. So again, a 14-year-old child is pretty much understandable. He's not like a young child, and he can speak English. The patient complained of tooth pain, which was excruciating. Now, the key word here is excruciating, like sharp-shooting pain. And also, there is a swelling in the right lower posterior region. He has not been to a dentist for many years. Intraoral examination showed a large polypoid lesion about 1.5 by 1.5 centimeter wide, with a 2 mm diameter stalk protruding from the carious cavity of forceps. Pulpal growth was pale pink in color and was covering the entire carious cavity in relation to forceps. He has no missing teeth or carious teeth other than the accused tooth. Now, why this last line is important? That entire last line is a big keyword. So he has no missing teeth, means none of the teeth have been extracted so far, and or carious teeth. So in general, his mouth is extremely healthy. Only this one particular tooth has a problem, which means probably his oral hygiene is pretty much good. So there has to be, like, this is like a one-off incident. You can't say that the oral hygiene is poor and that's why he's happened to have this problem. It's just a one-off incident. So what are the keywords that I will take? A young patient, an Aboriginal, can't speak English, is accompanied by his son, excruciating pain, there is a swelling, and visibly you can see a polypoid lesion. Now, on the first look itself, even without seeing anything, the first hit that I will get is probably looks like a chronic hyperplastic pulpitis, because that's how exactly these lesions look. Amongst all the pulpitis, this chronic hyperplastic pulpitis is the most visibly dramatic form, where you'll see a big hollow of the tooth and a big gum-like tissue over it. But it's not the gum, it's the pulp which has mushroomed out, you know. So you have pulpal hyperemia, you have reversible pulpitis, irreversible pulpitis, necrosis, and you have chronic hyperplastic pulpitis. Now, these are the five main types of pulp lesions, the pulpal issues that you may encounter, and all of them have a different approach. towards the treatment. So you should be able to diagnose it properly. But of course, you're going to take an X-ray and confirm what is happening. But at the first look, this is what should hit your mind, that it looks like in a young patient, especially because in young patients who are healthy, the pulp gives out this dramatic response and mushrooms out. Though it is insensitive to touch sometimes and there's pain only on biting, but of course, when it gets infected, it can give you an excruciating pain, which is exactly what the patient is complaining about. Let's see now what are the questions. How to proceed with investigation of patient's complaint? Investigation means you have to do something to get to know the diagnosis. Now, you don't treat the patient until you find the translator. Okay. No interpreter are available for Aboriginal language. That's wrong. His son can translate procedure to his father. Kind of a right answer. They will not need to book again through the interpreter telephone. She will need to book again through interpreter telephone, meaning you can send the patient away and then you will arrange an interpreter and then you're going to communicate through that. Relatives are not reliable as interpreters, which is kind of correct. Now, out of all these options, the question doesn't mention that there is some fight between the father and the son, or the son is not in favor of what is happening, or the son is the legal guardian. He's not, because he's just 14. Okay, so, in such a scenario, because the child is 14 and he's able to speak English, you can pretty much rely on the son to translate the procedure or the investigations that you're about to perform to the father. Now, I know a lot of people will ask that there is another question in which a father is accompanied and he speaks some other language, old father, around 60s or 70s, and he's accompanied by his daughter who's around 30s. And you are explaining an investigation or a treatment, and the daughter doesn't like that, and she is like, instead of saving the tooth, you extract. And she's telling that to the father, and the father is not happy about it, but the father is not able to communicate with you because there is a language barrier, and the daughter is instructing you, go ahead and extract, even though you can make out from the body language of the father that he's not happy about it. So in that scenario, I would choose, if the same options were there, to arrange for an interpreter. Because see, the patient has to agree for the treatment. Now, if you are not able to communicate and a relative who's accompanied, be it son, daughter, wife, etc., and they are putting their own judgments and decisions and forcing you to do something what the patient doesn't want, then you as a dentist have a moral responsibility to take the consent from the patient itself. And if there is a communication barrier, you have to arrange for an interpreter. Now, in this question, there is no fight which is going on, and the son is not the legal guardian, anyways. All he has to do is translate. Now, if the question mentioned the son is unable to do so, then you would be arranging an interpreter. So, because that is not the scenario here, you would choose the option as his son can translate the procedure to the father, right? So that would be my right answer. So don't get confused. None of the questions in Australian dental exam, even though they may sound similar, if the scenario is changing even one word, the options, even if though the same, the answer would change. You cannot memorize the questions. You have to understand each scenario is different. Understand? So each answer would also be different. But if your concepts are clear, you will be able to solve. But if you memorize, okay, if this kind of question comes, I'm going to mark this one, then you're not going to clear the exam. You understand? So yeah, let's go ahead. You took a radiograph. What is your diagnosis? Now I see a molar here. The roots are pretty much nice. There's a huge lesion right in the pulp. Now, because I've seen the clinical picture, and now the roots are pretty much nice, I know that there is no furcation involvement which has led the gums to overgrow. It's actually the pulp which has proliferated. Uh, no brainer. You can just choose hypoplastic pulpitis or a proliferative pulpitis, a chronic hypoplastic pulpitis. This is not reversible. It is not irreversible either, because the pulp has mushroomed out. If the tooth was intact and there was a small cavity with no visible pulp, then you could have chosen irreversible pulpitis or even necrotic pulp for that matter. But since that is not the scenario, you can visibly see the pulp in the oral cavity in the tooth. There is a diagnosis called as chronic hypoplastic pulpitis, and so you're going to choose that. Understood? Now we come to the patient has the history of rheumatic heart disease. See, in Aboriginal people, mostly they do have some or the other form of rheumatic heart disease. So whenever you just see the keyword as history of rheumatic heart disease, immediately, even if I before I read the options, I know this is going to go towards antibiotic prophylaxis. What is the appropriate antibiotic prophylaxis? uh, 99% that has to be the second line in the question. So be happy because you know the answer. Now, such kind of questions, you cannot make a mistake. Now, this is dentistry. This is basic dentistry. Regardless of whatever scenario has been given, it's a straightforward question. Patient needs an antibiotic prophylaxis. Which one would you give? And the standard answer is amoxicillin 2 gram orally 1 hour before the procedure, according to the latest guidelines. In case the question had mentioned the patient is allergic to amoxicillin, then I would have chosen the answer as clindamycin, because that is the only possible answer out here. So just because the above two sub questions were not related to the antibiotic prophylaxis, and if the scenario would have mentioned the patient is allergic to penicillin, you should not forget when you read this sub question. Just in your haste, don't forget that thing if the question would have mentioned, because a lot of candidates do that and they regret, oh, the question that mentioned the patient was allergic. Don't get lost. Be very conscious. Give oxygen to your brain. Breathe. That's why to all my candidates, I had written a big tip just before they were going to give the exam, that after every 10 or 15 questions or so, just close your eyes and breathe. Because unless your brain has oxygen, you'll get tired because constantly you have to see the screen and you even forget to blink the eyes because it's so daunting task to clear so much of questions, by reading so that you don't miss anything. The oxygen supply to the brain is very important because it makes you aware. So read the question. So in this scenario, because they have not mentioned the patient is allergic, I'm straightforward. I'm going to choose amoxicillin, no brainer. Now, what is the appropriate management for this tooth? Now, send patient to hospital waiting list. Why? You are a dentist, you are capable of doing a root canal procedure, so you can initiate. So option D is not wrong, but it's not required here. Extraction, not a wrong option either. You can very well choose to extract, but when you saw the radiograph and you think the roots are decent and you can still save the tooth, I will place this option low on my priority. Do nothing and wait for the biopsy result. It's a pretty straightforward diagnosis. I mean, there is no point waiting for the biopsy result unless you suspect that there is something else going on. Again, it's not a wrong option, just low on my priority list. Remove the tissue and send for biopsy and commence RCT. Now, out of all these four options, this seems more appropriate. Not that the other three options are wrong. They are also correct in their own way. But if I'm having a more appropriate option available, I'm going to choose that. A lot of candidates, the first time ADC given candidates and the recently passed out graduates, they think the ADC exam is like a straightforward MCQ question. Like four options will be wrong and one is right. No, it's not so easy. All the five options would be right, so you have to choose the best one out of it. So don't get confused and keep on asking, why have you chosen this answer and why not the next one? Because this is the most appropriate one. You can choose other option. Now, if somebody would have said, I want to extract the tooth, you're not wrong. But if you can save, then why not? Now, in case the patient himself says, you know what, extract the tooth, I don't want to save. Is that wrong? No, it's right. It's the patient's wish. Even if you can save, if the patient said, I want to extract, you would go ahead and extract, right? So a lot of sub questions will be having all the five options, which are all of them correct. So you have to really understand the scenario, use your brains, put the filters, and choose which is the most appropriate one. And the last one, you decided to do a biopsy of the lesion, and the pathology lab is 3 hours away from your surgery. Okay. Which medium you can use to transport the excised tissue? Zinc formalin, I've never heard. Carnoy solution, I think that is used for marsupialization. It's very caustic. Normal saline, it's going to cause osmosis, hyperosmosis, I think something like that. 10% formalin, yes, we all know that formalin fixes the tissue in its own state. Now, it is 10% formalin. Now, example, the options were 10% formalin, normal saline carbonate solution, zinc formalin, 5% formalin. So you need to know the percentage. It's 10% formalin. You cannot choose any other concentration of formalin. So that's it. What you should learn from this question is that you should read all forms of pulpal diagnosis. Go read about reversible, irreversible necrosis, phoenix abscess, chronic abscess, acute abscess, everything, and the treatment for it. Read about antibiotic prophylaxis, read about rheumatic heart disease. Yeah, so you should read all these things. This is lateral thinking. This is reading about topics associated with this sub question. I mean, this scenario based question. Because if they can ask this question, they can ask questions related to all the topics that I've just mentioned. That's how you study. So I hope you have you understood how to think for the exam to solve the question, and not just read and jump on the answer. You should identify the keywords and actually think what they are actually asking. Read between the lines. So yeah, that's about the question. You can stop this video, and because for the next 2 minutes I'm just going to talk random things. The reason I could not take a video for the long time, because after the last video I think I had mentioned that I was going to Varanasi in India after 2 years, actually taking a break, and it was really exhausting 2 years for me, various reasons. So I went to Varanasi. I went to the clinic. I finished my patients from there itself. I went to the airport and I was really exhausted. And I thought I could manage the layover flight because I flew from Dubai to Bombay, and then I had to wait for 4 hours. And then I picked up my mom. She came to the airport, and then me and my mom and my sister went together. Bombay to Varanasi is again 2.5 hours, and I had taken the night flight. So already I was exhausted during the day, and I took the flight and I reached basically in the afternoon to Varanasi. So, and I didn't sleep well. And anyways, for that entire week, because I was traveling for 4 days, I didn't take a break. So my body was so exhausted. I thought I could manage, but I could not. So once I reached there, I was relaxing, but there was a lot of queue for the prayers. I had gone to give my, what do you say, prayers and everything to the Kashi Vishwanath temple, and it's so crowded, my God. Beautiful temple, a lot of spirituality, divination, felt a lot at peace, but I exhausted myself, something which you should not do, and but I did it anyways, and the result of that was while coming back, I felt terribly sick. Like I never ever had sinus headache, or I never had sinus congestions in my sinus here and here. And the moment I came back to Dubai, my God, my this maxillary, my frontal sinus, probably my ethmoid sinus, all were just blocked. I just could not breathe from my nose. I got a CBCT scan done and they were all filled up. I visited the ENT. I practically cried in front of him. He did the endoscopy and he was like, it's just a bad cold, just relax, it's going to go away, but you will be ending up taking 15 days of antibiotic. So from 1st of March till almost 17th of March, I was on antibiotics, and for at least a week, I was having this bad headache. I just could not sleep because I could not lay down properly. Yeah, it took a while for me to recover. So amidst all this, I just could not take a video. Plus, my course of space maintainer and strip ground was coming up, so I had to prepare for that. Uh, so a lot of things were going on. So I just could not. But I just could manage to be for all the exam going candidates, and I was solving all their doubts on the WhatsApp all the time, leaving them voice notes. I'm glad the exam went well because all of them who gave the exam, I think there were 22 or 23 of them who were giving this March exam, and all of them said that the mocks really helped, especially the last paper, which I think had released the mock 25 just a week before the exam. A lot of questions, prosto questions came from that. So I was glad that they were confident about it. So they were very happy, and since they were happy, I was happy that at least they were prepared. Result is in God's hand, but at least you don't feel bad that you are taken by surprise in the exam, you know. So yeah, that is what is up with me. Yeah, but I'll try to be more regular in posting more videos. As of course, I do get a lot of emails saying post more videos, but you have to understand that here also I have so many things to manage. It's really difficult to get time and my own health because you have to juggle with so much, and especially all my friends who have their children who are grown up or are in the age group of 1 to 5. All of them have told me, because I keep on asking them, since the time my child has started going to nursery, it's me who's falling sick half of the time. So they were like, it happens. The child of course gets cold and cough because he has to build up immunity, but he transfers it all to me. And then once I get cold and cough, it's so difficult to talk. I barely can manage with the patients because then you start coughing a lot, and you have to talk so much to the patients. Being a pediatric dentist, it's not like the adults that you just ask them to open the mouth and they open the mouth. Children, you have to keep on communicating with them. So anyways, couple of good cases. I've finished off ortho. I will share the cases later on. One of my tongue tie article got published. I shared it to all my enrolled candidates. I was very happy about it in a journal. So yeah, that's what the update. Leave your comments. Let me know uh, what all topics you want me to make videos, or is there any particular thing you want me to explain in detail, or your experience of the ADC exam, if you have given one, if you have passed one, what you would like to say to the other candidates, or anything, just establish a communication. So yeah, that's it. Thank you.